Stop looking at your lower back for the cause of your sciatica and look at your heels. If you are over 60 and have dry, cracked skin on your heels or unexplained oiliness around your nose, your body is signaling a critical breakdown in myelin sheath integrity. Most seniors are told their leg pain is structural, but for many, it's actually age-related hypochlorhydria, a 40% drop in stomach acid that makes it impossible to absorb the vitamin B12 your peripheral nerves use as electrical insulation. Today, I'm showing you the cracked heel protocol to stop nerve leakage and repair your peripheral nerve pathways from the inside out. Welcome. If you are watching this, you are likely exhausted, frustrated, and running on empty. You are losing sleep. You have probably been put through the medical ringer. You have had the imaging done, the X-rays, the MRIs, and your doctor has rightly pointed out some wear and tear. They point to a compressed disc, they point to spinal stenosis, they point to arthritis in your lower lumbar spine, and they hand you a diagnosis of old age. Those structural diagnoses are valid, they are real, but they almost always tell only half the story. What we are going to explore today is the massive, hidden, biochemical piece of that puzzle that regular medicine simply does not have the time to explain to you in a standard 15-minute consultation. We are not dismissing your medical history. Instead, we are looking at how to biologically support your body's natural repair mechanisms. We need to give your peripheral nervous system the strength, the density, and the armor to withstand those structural pressures without sending blinding pain signals to your brain. You have been told to accept the pain. You have been told to manage it with pills that make you groggy, or physical therapy that only works for an hour. But your body is highly intelligent. It is trying to communicate with you. To understand how we can cool down that burning sensation in your feet and legs, to understand how we can turn off the internal alarm bells, you first need to understand the physiological reality of what is happening inside your nervous system when the pain hits its absolute peak. Listen closely, because this will change how you view your body forever. Let's talk about the reality of your peripheral nerve pain. Let us talk about the sheer, unrelenting, maddening agitation it causes. You know the exact feeling I am talking about. You have pushed through a long day, you finally lay down in bed, the house gets quiet, you close your eyes hoping for a few hours of restorative sleep, and then the nightmare starts. It usually begins as a deep, hollow ache. Or maybe it starts as a strange, unnatural tingling in your toes or the meat of your calves. Then it shifts. It transforms into a hot, searing sensation. It might feel like you are wearing socks made of crushed glass. It might feel like fire ants are crawling under your skin. Sometimes, even the light touch of a cotton bedsheet against your feet sends a jagged, violent shock all the way up your leg. It wakes you out of a dead sleep. It drains your energy for the next day. It throws off your balance. It makes you afraid to walk down the stairs. It severely impacts your daily mobility and steals your independence. Why does it feel this way? Why does it feel electrical? Why does it feel like pins, needles, and literal fire rather than a standard dull muscle cramp? Because your peripheral nerves are, quite literally, electrical wires. Your peripheral nervous system is a massive, incredibly complex network of biological wiring. It runs from your spinal cord all the way down to the furthest microscopic tips of your toes. To safely and efficiently conduct high-speed electrical signals from your brain to your extremities, these biological wires need to be wrapped in a thick, protective, highly specialized insulation. In human anatomy, that insulation is called the myelin sheath. When we are young and our digestion and nutrient absorption are functioning flawlessly, our bodies are in a constant state of rebuilding, repairing, and fortifying this insulation. Every single time there is microscopic wear and tear from walking, running, or bending, your body patches it up. It is an endless cycle of cellular renewal. But as we age, a critical, devastating missing link occurs. When your body becomes chronically deficient in vitamin B12. specifically the active form known as cobalamin. It loses the vital raw materials required to manufacture and maintain that protective coating. The insulation literally thins out over time. It frays, it degrades, it leaves the inner core of the nerve exposed. And here is the terrifying reveal. When that insulation thins out, you are left with a raw, exposed nerve pathway running all the way through your leg and into your feet. When that uninsulated, raw nerve is subjected to mechanical pressure, like from that slightly bulging disc your doctor identified, or when it simply rubs against surrounding muscle tissue and fascia as you walk, it short circuits. The high-voltage electrical signal meant to tell your foot to move sparks out into the surrounding tissue. It misfires. That shooting, burning, uncontrollable pain, the sudden, terrifying numbness, the tingling that drives you crazy, you are not imagining it. You are feeling the biological equivalent of an electrical short circuit inside your own leg. Your structural diagnosis of a bad back is completely valid. But the reason that structural pressure hurts so incredibly much, and the reason that pain radiates so far down into your feet, is almost always because the nerve lacks its protective cushioning. A healthy, fully myelinated nerve can withstand a massive amount of physical pressure without triggering pain. A demyelinated, starved nerve will scream in agony at the slightest touch. Until you provide your body with the exact form of vitamin B12 needed to rebuild that insulation, the nerve remains highly sensitized, hyperreactive, and stuck in a state of emergency. So that brings us to the most important logical question. Why are you suddenly deficient in vitamin B12? You are probably not a strict vegan. You might eat steak, eggs, and dairy. You might even take a daily multivitamin from the grocery store. So why is your myelin sheath starving right now? The answer is going to infuriate you, because it has everything to do with a hidden silent shift in your digestive system that traditional medicine almost entirely ignores. Stomach acid trap. This is a common, silent, deeply destructive biological shift that naturally occurs as we age, and understanding it is the absolute key to rescuing your peripheral nerve health. As we cross the age of 60, our bodies undergo massive physiological changes. One of the most impactful, yet rarely discussed in a standard rush doctor's visit, is a condition called age-related hypochlorhydria. This is the medical terminology for a natural, gradual, but severe drop in your stomach acid production. When you are in your 20s, your stomach is a highly acidic, churning, nutrient-extracting furnace. Its pH is incredibly low, designed to melt down food and rip nutrients away from their binders. But by the time many of us reach our senior years, the specific cells in our stomachs that produce this acid, called the parietal cells, simply tire out. They become sluggish. They begin producing roughly 40% less hydrochloric acid than they did in our youth. Your stomach environment goes from being a roaring furnace to a much milder, weaker, less efficient environment. This single physiological change is the root cause of your B12 deficiency. Let me explain exactly why. Vitamin B12 is a massive, highly complex molecule. When you eat a piece of beef or a piece of fish, that B12 does not just float around freely. It is tightly chemically bound to the animal proteins. To break that tough protein bond and extract the B12 so your body can use it, your stomach requires highly potent, scorching stomach acid. If your stomach acid is weak, you cannot cleave the B12 away from your food. You digest the meat, but the B12 passes right through you, locked inside the protein, completely unabsorbed, but it gets worse. Your stomach is also responsible for producing something called intrinsic factor. Intrinsic factor is a highly specialized glycoprotein. I want you to think of intrinsic factor as a biological taxi cab. Even if you manage to extract a tiny bit of B12 from your food, that B12 cannot survive the journey through your digestive tract alone. It must immediately bind to this intrinsic factor taxi cab. The taxicab safely transports the B12 down into your small intestine, where it can finally be absorbed into your bloodstream. If your parietal cells are failing due to age, two catastrophic things happen simultaneously. First, you do not have enough acid to extract the B12 from your food. Second, you do not produce enough intrinsic factor taxicabs to transport whatever B12 you do manage to extract. This is exactly why simply buying standard, cheap vitamin B12 pills from the pharmacy leads to zero relief. Those pills usually contain a cheap synthetic form of B12 called cyanocobalamin. When you swallow that hard compressed tablet, it drops into a stomach that lacks the acid to break down the pills binders and lacks the intrinsic factor to absorb the synthetic vitamin. It passes right through your digestive tract. You are flushing your money down the toilet, and your nerves continue to starve. You are spending your money, but your body isn't given the environmental tools to absorb the nutrients. So, what does this catastrophic drop in B12 absorption have to do with the dry, cracked skin on your heels and the oiliness on your nose? This is where human survival biology proves how incredibly, ruthlessly smart it is. Your body operates on a strict triage system. It is always calculating how to keep you alive for one more day. When your stomach acid drops and you stop effectively absorbing B12, your brain realizes it is facing a severe, life-threatening shortage of this vital nutrient. To keep you alive and functioning, your body aggressively hoards and prioritizes the tiny, microscopic amount of B12 you do manage to absorb. It funnels it entirely to your vital survival organs, your brain, your heart, and your bone marrow to create red blood cells. In doing so, the body makes a calculated sacrifice. It pulls resources away from your peripheral tissues. It abandons the furthest edges of your body. The very first biological structures to physically manifest signs of this peripheral nerve starvation are the autonomic nerves in your feet. These are the microscopic nerves that control your pseudomotor function, meaning they control your moisture and sweat glands. When these autonomic nerves in your feet are starved of B12, they misfire and shut down. They stop telling your sweat glands to produce moisture. Because the thick, calloused skin on the bottom of your feet relies entirely on these glands to stay supple, the skin dries out completely. It loses its elasticity, it turns hard, it flakes, and eventually it tears open, forming deep, painful, bleeding cracks. Meanwhile, the sebaceous glands on your face experience a similar autonomic misfire. In a panic to maintain the integrity of your facial skin despite failing cellular health, these glands overcompensate. They begin pumping out excess sebum, causing a strange, unexplained waxy oiliness or redness right in the creases of your nose and sometimes on your forehead. If you have severely cracked heels, an oily nose, and a highly sensitive, burning, tingling, or numb foot, your body is not just experiencing random symptoms of aging. Your body is practically screaming at you that its biological triage system is fully active. It is starving for B12, and it lacks the stomach acid mechanism to get it from your diet. We have to bypass the trap. We have to circumvent the aging digestive system and deliver those raw materials directly to the nerve pathways. Here is exactly how we do it. This is the solution. This is where we take actionable biological steps to support your body's nerve repair processes. The Cracked Heel Protocol is a targeted, non-negotiable, 3-step method designed to accommodate an aging digestive system, completely bypass the intrinsic factor bottleneck, and deliver the exact raw materials your nervous system needs to rebuild that myelin sheath. Please pay close attention. These steps are designed to work synergistically. You cannot do Step 2 without Step 3. Listen to the biology. Step 1. Wake up the acid. You cannot optimize digestion if your stomach environment isn't prepped. Even though we are going to bypass the stomach for the B12 itself, we still need your stomach acid functioning to extract the partner nutrients from your food that make the B12 work. About 15 to 20 minutes before your first major protein-rich meal of the day, we want to gently and artificially lower the pH of your stomach. We want to turn the digestive furnace back on. You have 3 options to support this acidic environment, depending on your tolerance. Option A is the most highly recommended. Mix exactly 1 tablespoon of raw, unpasteurized apple cider vinegar, the kind with the cloudy mother floating at the bottom, into a small glass of room-temperature water. Drink it down. Option B is for those who cannot stomach the taste or acidity of vinegar. Squeeze the fresh juice of half a lemon into a few ounces of water and drink that instead. Option C is for those who want a clinical, precise approach. Ask your doctor or functional practitioner about using a high-quality digestive enzyme supplement that specifically contains betaine HCl, which is literally supplemental hydrochloric acid, and take it right before you begin eating. By taking this step before you eat, you are sending a massive chemical signal to your digestive tract that food is coming, optimizing the environment to break down proteins and extract the secondary cofactors your nerves need. Step 2. The electrical vitamin, the B12 bypass. Because we already established that your senior stomach struggles to produce intrinsic factor, we cannot rely on standard digestion or standard pills to get B12 into your blood. We need to introduce the crucial building block, vitamin B12, in a way that bypasses the hostile stomach environment entirely. To support peripheral nerve health effectively, older adults must absolutely abandon synthetic cyanocobalamin. It is useless for neuropathy. You must use the active, bioavailable form of B12, known as methylcobalamin, and you must take it sublingually. Here is the sublingual secret. Do not swallow a hard B12 pill, ever. You must purchase a high-quality methylcobalamin liquid drop formulation or a sublingual lozenge. You place the drops or the lozenge directly under your tongue and you let it sit there. You do not swallow it. You let it dissolve completely into the floor of your mouth. Why? Because the mucosal tissue under your tongue is incredibly thin and densely packed with capillary beds. When you let the methylcobalamin sit there, it absorbs directly through the tissue and straight into your bloodstream. It completely bypasses your weak stomach acid. It completely bypasses the need for intrinsic factor. It acts almost like an intravenous injection, flooding your blood with the exact form of B12 your brain and nerves are begging for. For severe nerve support and active neuropathy, functional practitioners often recommend high therapeutic doses, generally between 1,000 micrograms to 5,000 micrograms of methylcobalamin daily. Because B12 is water-soluble, it is incredibly safe, and your body will simply pass what it does not use. However, always confirm this exact dosage with your primary care provider to ensure it aligns with your specific medical profile. Step 3. The myelin matrix catalyst. This is the step that 99% of people, and even many doctors, miss. This is the step that ties the entire protocol together. You've prepped the acid for your food. You've bypassed the stomach trap with sublingual methylcobalamin. It is now in your blood. But how do you ensure the body actually uses that B12 to build insulation around the sciatic and peripheral nerves? Vitamin B12 does not work alone. It is an architect, but an architect cannot build a house without bricklayers and bricks. To successfully synthesize the myelin sheath, B12 requires a biological partner called folate, also known as vitamin B9, and the sheath itself, the physical rubber insulation, is made up of nearly 80% lipids, which are fats. Whenever you take your sublingual B12, you must consume it alongside a myelin matrix catalyst. This is a dietary combination of natural folate and high-quality, healthy fat. If you take your B12 on an empty stomach with a black coffee, it has no building materials. You must give it the bricks and the mortar. Within an hour of taking your B12, eat a heavy handful of raw walnuts or almonds. Slice up and eat half of a fresh avocado. Eat a large serving of dark leafy greens, like spinach or kale, which are packed with natural folate, and drench them in cold-pressed extra virgin olive oil. Or, eat 2 whole, organic, pasture-raised eggs cooked in grass-fed butter. The folate acts as a coenzyme, working perfectly in tandem with the methylcobalamin in what is called the methionine cycle, to create the nerve-repairing proteins. The healthy fat, the olive oil, the butter, the avocado, acts as the actual physical building block for the lipid-rich insulation itself. Prep the digestive environment with acid. Bypass the stomach with sublingual methylcobalamin. Deliver the physical building blocks with folate and fat. That is the triad of peripheral nerve repair. Let S discuss the timeline so you have realistic expectations, so you do not get discouraged and quit right before the miracle happens. Nerves are some of the slowest healing tissues in the entire human body. They generally regenerate at a rate of roughly 1 millimeter per day. That is incredibly slow. Rebuilding a microscopic physical structure across the entire length of your leg takes time, patience, and unyielding consistency. You did not strip your myelin sheath in a week, and you will not rebuild it in a week. But if you execute this protocol every single day, here is a general biological time frame for what you might experience. Within the first 14 to 21 days, you may begin to notice a subtle shift in the temperature and nature of your discomfort. The intense, sharp, jagged nighttime burning often begins to cool down. It might turn back into a dull ache. If you suffer from severe numbness in your toes or feet, pay close attention to this next point. During this first month, you might actually experience a temporary increase in tingling, prickling, or stinging sensations. Do not panic. Do not stop the protocol. This phenomenon is incredibly common. It is often a sign that a dormant, previously starved numb nerve is finally waking up. It is receiving the supportive nutrients it needs to conduct electricity again. And as it comes back online, it fires off erratic signals. This waking up pain is a sign of profound healing. Push through it. Within 60 to 90 days, I want you to sit down, take off your socks, and look closely at your heels. When you see those deep, jagged cracks beginning to permanently close up, when you see the dry, flaky skin retaining moisture and turning pink and supple again, and when your facial skin balances out, you have visual, undeniable confirmation that your protocol is working. Your body's triage system has turned off. Your brain realizes it has an abundance of B12. It stops hoarding it. It releases it to the peripheral tissues, and both your autonomic sweat nerves and your peripheral sensory nerves reap the benefits. The short circuit is being repaired. A vital safety note before we conclude. Always consult your primary care physician before starting new high-dose supplements or protocols. If you have a diagnosed autoimmune condition called pernicious anemia, where the body actively attacks its own parietal cells and intrinsic factor, or if you have severe, rapidly progressing diabetic neuropathy, you may require clinical, high-dose B12 injections administered directly into the muscle by your doctor. This nutritional protocol is designed to complement the care and structural guidance your doctor provides, not replace it. Furthermore, if you have a history of severe stomach ulcers or gastritis, skip step 1 entirely, as adding apple cider vinegar or betaine HCl can irritate the stomach lining. You have so much more power over your daily comfort and your aging process than you might think. You do not have to accept the narrative that your body is just breaking down, and there is nothing you can do about it. By understanding exactly how your digestive system changes with age, by understanding the mechanics of stomach acid, and by realizing how a simple, hidden B12 deficiency masquerades as structural spinal pain, you can take control. You can provide your body with the exact biological tools it is begging for to support its own structural integrity. Address the stomach acid. Bypass the digestive trap with sublingual methylcobalamin. Support the nerve insulation with folate and healthy fats. Stop the short circuit. I want to know who is taking this massive step toward nutritional empowerment today. I want to know who is refusing to just lie in bed and suffer. If you are going to incorporate the cracked heel protocol into your routine starting tomorrow morning to support your peripheral nerves, go down into the comments section right now and type the word nerve. Type nerve in the comments. I read these comments, I see you, and I want to know exactly who in this community is actively taking charge of their nervous system. If this deep dive helped you connect the dots between your failing digestion, your cracked heels, and your burning feet, make sure to hit the subscribe button right now. We are building a movement here. We are a community focused on deep, actionable nutritional science that complements your healthy aging journey, exposing the truths you want to hear in a 15-minute clinic visit. Your golden years should be spent moving. They should be spent walking the dog, traveling, playing with your family, and enjoying the life you built. They should not be spent trapped by burning feet and radiating leg pain. Hit subscribe, leave the word nerve in the comments, stick to the protocol, and take back your health today.